Hi, I'm Dr. Mark Poray, a family and sports chiropractor in Whitby, Ontario. In this blog, I'll be talking about chiropractic care of low back pain. Some of the biggest questions regarding chiropractic care are: is it safe, is it effective, and is it cost effective? Formal chiropractic care actually started in 1895, and since then it's been the center of controversy regarding those three questions. Over the last 25 years, no fewer than 6 formal government studies were done in Canada, Australia, New Zealand, and Sweden. All of these studies found that chiropractic care is safe, effective, and cost-effective, and recommended that it actually be included in public health care funding. In 1993, the Ontario Ministry of Health commissioned a study by Dr. Pran Magna from the University of Toronto. He was an independent assessor, and he needed to address these questions. The report concluded that there was an overwhelming body of evidence supporting the effectiveness of chiropractic care for low back pain, and that there would be significant cost savings if more low back pain was managed by chiropractors, and that chiropractic services should be fully funded and insured by the Ontario Health Insurance Plan. In 1996, Stano and Smith found that low back pain managed by chiropractors versus medical providers was half as costly, and the quality indicators for satisfaction suggested that chiropractic deserved careful consideration in gatekeeper strategies adopted by employers and third-party payers. In 1996, Mosley and Alana found the same results for low back and neck pain in terms of chiropractic care versus surgical interventions, and with a substantially lower cost per patient. In 1991, a study by Wagan et al. Compared chiropractic care with general medical care and sham manipulations. It was found that both the medical and chiropractic patients improved, but only the chiropractic patients improved significantly. In 1987, MDs reported in the prestigious Lancet Medical Journal in England that a comparison of chiropractic manipulation versus pain injections showed better results for the manipulations. They further concluded that this care was safe and effective. In 1995, the Medical Research Council in England did an extensive study comparing chiropractic care for low back pain with medical care in hospital settings. It found that there was significant immediate improvement from the chiropractic care by comparison, and that the medical care showed significant deterioration after 6 months. They further found less work time was lost with the chiropractic care. Now, in 1991, a study by Jarvis and Phillips in the U.S. and Abral in Australia found that chiropractic claims tended to be 60% as costly as those of medical care, and that medical patients were 10% more likely to develop chronic low back pain. In 2004, the BEAM study in Britain found that manipulation was a significantly better treatment on all measurement scales than general medical care through a full year of trials. In 1991, the governments of the US, the UK, and Denmark did multidisciplinary research and found that the best care incorporated a number of approaches. First, analgesics and anti-inflammatories should be used only briefly, that it should include advice on staying active and the earliest possible return to normal activities, that it include chiropractic manipulation, that it should include back education classes with exercise, that there should be patient reassurance, that there should be a focus on functional as opposed to structural causes of pain, and that consideration of the psychosocial factors associated with pain be considered. Now, in spite of overwhelming positive research supporting chiropractic care for low back pain, the AMA in the US and the CMA in Canada have been extremely slow in following the recommendations of this research. For many years, there appeared to be a concerted effort by the American Medical Association, the AMA, to control and eliminate chiropractic as a competition to medicine. Finally, in 1992, the U.S. Supreme Court ruled that the AMA was to cease and desist in activities which included what they considered unethical and illegal methods to get rid of the competition of chiropractors. They further ordered the AMA to print retractions and to allow their members to associate, consult, and practice with chiropractors. Now, my advice after all this on any treatments that you're looking for are that you proceed from the least invasive to the most invasive. The least invasive is manual physical therapy, and research has shown that chiropractic is the most effective of these. Now, should this fail, then the next step would be pharmaceuticals, and then the most invasive and the final step should be surgery as a last resort. Now, whoever you decide to talk to, ask them what is the likelihood of improvement? What is the percentage chances of you getting better? How long is it going to take to get better? And what will your life be like afterwards? In other words, what is the long-term prognosis? I hope this has been a little bit helpful to you in looking for care for your low back or low back pain. If you are interested in any more of my web blogs, please check my website at www.drporay.com. And for an appointment or a consultation, you can call the Brooklyn Family Health Center at 905-655-5767. We're located on Highway 12 between Whitby and Brooklyn. Thanks again for listening.